Hi, my name's Phil. I'd like to talk about politics, and the winner for the poll for today's video was about the NHS crisis and how Brexit has exacerbated it. So basically, in the past 2 years, in an NHS already short on trained medics, 5,000 nurses from other EU nations have left, with most of them blaming Brexit for it. It's not just the uncertainty over whether or not they'd suddenly be told overnight they had no job, because that was a realistic prospect. If we left without a deal overnight, it's like, well, do you even have a job? May even be told they have to leave the country, which means leave their homes and everything like that. So many foreign workers who've been living in the UK quite happily for years, it's not just that uncertainty, it's the fact that before they were very happy, they felt part of a community. Afterwards, quite a lot of reporting that they've been made to feel very unwelcome, like an outsider that's not wanted around. And I don't know if there are more racists in the UK than other developed countries. Perhaps most countries, and the UK maybe used to, keeps a lid on the problem by making it crystal clear that such views are not supported. So racists mostly keep their venomous comments within their own echo chambers, some dark corner of the pubs or in their own homes. But the Brexit result, where foreigners were very much demonised by the main Leave campaigners, suddenly allowed these closet fascists to think that the majority of the country were with them. They couldn't conceive that people may have voted Leave without hate in their hearts, because hatred was what it was all about for them, and the verbal and physical abuse suddenly went up. The number of attacks, assaults increased massively. But whatever the reason, the struggling NHS is down thousands of nurses and 10,000 health workers altogether. There's 100,000 staff, if you want to, the full scale of the problem that the NHS is short of. The funding's there, the vacancies are there, the people are not. There's been an increase in the number of UK trained nurses and midwives, and fewer of those have been leaving the NHS, which has certainly helped, otherwise it could be even worse. But the NHS already had many vacancies unfilled. So any massive loss of those numbers can't be compensated, even if you're increasing the number you're getting from elsewhere, whether within or without. So to put that 5,000 figure into context, the NHS in England alone, which, yes, is the largest part of the UK, is short 40,000 nurses. Now, I haven't been able to find specific figures for other parts of the UK, but nursing groups in the other parts have all been warning their devolved parliament about the crisis and the risk of more leaving if vacancies are not filled. So the same issues exist throughout the rest of the UK. And nurses leaving the profession is double trouble. You know, even before Brexit, one of the main reasons cited for nurses leaving the NHS is overwork and stress. Now, the issue is that when those nurses leave the hospitals and clinics and are not replaced, the remaining staff have to cover. They can't simply tell people not to be so ill or to stop getting themselves injured, or even to refuse to admit patients who are in need of emergency care. So the remaining nurses are overworked, and then these are who are, let's face it, they're very vocational, they've got a very caring nature. They see their patients suffering because they can't do enough to help them due to too few staff. And that hits them emotionally, as well as in terms of the overworked mental illness increases. And then they are more likely to leave, and that creates a destructive spiral. So it's all very well devolved Parliament and the government in Westminster as well, talking about new medics being funded. But if the places aren't filled, then the patients are not receiving their healthcare. And they're not going to be impressed just because the money is supposedly there. They can't be healed by a tenner. And that's the thing. The government and the devolved parliaments as well, they keep sort of mentioning how many places that they're funding for nurses to study. But if those places are not being filled and we're not getting them into the hospitals and clinics, what's the point? It also needs to be borne in mind that there are many countries that appreciate their medical staff, and there may be more attractive prospects overseas very often. But the government has been trying to recruit. It has dramatically increased recruitment for the NHS from outside the EU. I'd already mentioned in a previous topic that immigration total has actually massively increased as a result of Brexit. It's just not from the EU. The vast majority of that is from outside of the EU, and the same applies in healthcare. So as with all the mental health and work pressure from an uncaring government causing nurses to leave, we now have our own society making many of the others feel unwelcome. Now, I have to admit to feeling an uncharacteristic surge of anger when Theresa May said this week how great her government was at staffing the NHS, in the wake of this crisis. And it is a crisis. I mean, when it comes to healthcare, frankly, every time it's unable to provide the care that it should be doing, it is by definition a crisis because people's lives are wrecked in one way or another as a result of that. NHS trusts are now hoping to massively expand their recruitment from countries outside of the EU. At the end of the day, they recognise that they can only get so many people from the UK into nursing. They are now fighting a losing battle trying to attract people from the EU. So it has to be from elsewhere. They're hoping to fill up those 40,000 places by doing just that. But it occurs to me that if people in this country are making Europeans feel unwelcome, people with whom we have the closest cultural bonds, how are those from further afield going to be made to feel? Will nurses from Africa or Asia be treated any better? And if the perception gets out that the UK is an inhospitable place to emigrate to, that'll completely knacker any hopes of even trying to plug up those devastating gaps in the NHS roster. And this is all where we are now, leaving the EU but not actually having left it. Immigration was such a hot topic during the Brexit campaign that the government needed to give the impression that they are reducing it. Of course, one of the biggest lies about the whole thing is that the membership of the EU doesn't allow the government to control immigration. Well, it does. It's the UK government that has allowed quite a lot of free migration. Other countries in the EU do control the number of migrants living and working in their country, and it's all perfectly legal. So the government basically have announced plans to try and, appease those people who fell for the demonising tactics of immigrants. So they've announced plans for a £30,000 earning threshold for migrants to be able to come to the UK on those work visas. Laughable, of course, because much of the immigration that we need and that the government has indeed encouraged is for low-skilled work that we can't get our own population to cover. There was an interesting comment someone put in one of my videos yesterday, and I've seen reports on the same sort of thing. Someone saying they toured one of the largest farms in the country who are now really struggling because the migrants that work those fields, pick the crops, aren't there anymore. They're not coming. But nursing is highly skilled, of course. So surely that policy won't harm the NHS. I mean, we pay nurses a great wage, don't we? Oh, no, we don't. No, the starting salary for nurses is just over £22,000. Now, it takes a while for most to get to £30,000. A little bit like in teaching, I think. Now, in recruiting nurses from overseas, you would mostly be looking at young, newly qualified staff, of course at the bottom end of that scale, who of course like the idea of travelling abroad to work. You're much less likely to be successful trying to attract more senior nurses who have settled homes and families in their own countries. Besides, the vacancies simply aren't all going to be for senior pay scales, are they? So even with a shameful lack of hospitality on the part of some of my compatriots, the government's own policies would make it impossible to recruit, like literally impossible. Naturally, there's no way this policy could ever be implemented because it would be like a tactical nuclear strike on what would remain of our fragile post-Brexit economy. But even shooting their mouth off about such plans to placate the xenophobes is also going to be hitting a wider audience and will put off potential recruits from outside of the UK. So not only are we finding that some people will not have access to the drugs needed to live if Farage and his band of lunatics get their way, but there won't be anyone to provide the care or administration of them anyway. So that's the crisis that we're now facing in the NHS, which was a crisis before Brexit, and Brexit has now blown it wide open. Hope you found the video interesting. If you did, don't forget to click the like button, subscribe for further content, and until next time, I'll see you later.